Hi, this is Bob Vineyard with the Georgia Medicare Minute. Let's talk about Medicare, Obamacare, and Judy's Pancreas. Somebody told me that my videos are not very entertaining, and I thought, well, Medicare is kind of a dry subject, not exactly something that stand-up comics use as part of their routine, but besides that, I'm not here to entertain. I'm trying to educate people and help them understand Medicare. But enough about that. Maybe you'll find this one slightly entertaining. A few months ago, Judy, names have been changed to protect the innocent, found my site, and she went there and ran some Medicare supplement rates. I reached out to her, and I had sent her a couple of emails and some information and so forth. And then a day or two after she was on my site, I actually called her. Usually wait a couple of days because people who go on the internet are generally swamped with phone calls and emails and everything else, and the last thing they want to do is answer the phone and talk to another insurance agent. So I respect that, and I usually do give people a couple of days to kind of let the phone cool down a little bit and quit ringing so much. So I gave her a call. She didn't answer. I got her voicemail. I left a message, told her who I was, why I was calling, and thanked her for going to my site. Didn't hear from her. And so another couple more emails, and then finally I decided this isn't going anywhere. She turned 65 almost 2 months before she ended up on my site. So she's probably just really not interested in doing anything. She's made up her mind, but for whatever reason, she's still going on. I don't know, maybe she's a glutton for punishment. Who knows? She wants to talk to more agents. But so I sent her an email, and I said, I haven't heard from you, and I just assumed that there's really not any interest, and so rather than bother you anymore, I'm going to close your file. Well, a day or two went by, and I got an email from her, and she said, I have been very busy. I've already made up my mind on a Medicare supplement plan. I just need some advice on a Part D. And I thought, yeah, okay. So I ignored her comment about the Part D, and I sent her an email back, and I said, okay. And she had told me which plan, it was a Plan G, and which carrier she was going to go with. So I sent her an email back, and I said, any particular reason why you chose that carrier? And I just left it at that. Another day or so goes by, and she emails me back, and she says, well, they had low rates. So, okay. So I responded again by email, and I said, well, if you're looking for low rates, there are other carriers with lower rates, and besides that, if it were me, I would not pick that particular carrier. So she came back, and she says, well, what's wrong with that carrier? I said, we really need to talk. Well, I'm pretty busy, and I don't have time to talk. And I said, well, I'll agree to answer your questions by email, but at some point, we're going to have to talk. And so the next day, she sent me an email with a whole bunch of questions, and to which I responded, including sending some links to some of my videos that address the questions that she had brought up. Well, then I get another email, and she thanked me for my response, and she says, I have looked at every one of your videos, and I've made notes, but I still have questions. When can we talk? And I thought, I've got about 50 videos up there. She's looked at every one of them. They're about 4 or 5 minutes each, so that's a lot of time looking at old Bob on the computer screen there. But so we came to a time and day that was convenient for both of us. I gave her a call. We ended up talking for over an hour, and I answered all of her questions, including some that she hadn't even thought about yet. And so she said, okay, you've convinced me that I need to do follow your advice, and I need you as my agent. And I said, well, okay, that sounds good. when do you want to move forward on this? And she said, well, give me a day. I want to think this over and talk it over with my husband. She said, I'll get back to you. So I said, okay. Next day, she called back and she said, okay, I'm ready to pull the trigger. I'll go with the plan G, like I had decided, but I'm going to use the carrier that you suggested, even though I had already crossed them off my list. I think you had some salient points that I had not considered. So I took the information by phone and I submitted the application. And we talked a little bit more about the drug plan. I gave her some information there. She wanted to think about that. So, application's been submitted. The next day, I get a voicemail message, urgent. I need to talk to you. When does my Medicare supplement plan go into effect? Well, as soon as I got the message, I called her back and I said, well, we submitted this yesterday. The first of the month is about 2.5 weeks away, so that's when your Medicare supplement plan is going to go into effect. Oh, well, at least I still have my Obamacare plan, so it'll pay what Medicare doesn't. No, it doesn't work that way. Medicare and Obamacare plans do not coordinate with each other, and your Obamacare plan that you've been paying $600 a month for is not going to pay anything. So the good news is you have Medicare A and B, and so at least you'll have that. Why do you want your coverage to go into effect now? I went to a Mexican restaurant last night and they had a whole bunch of chips and greasy food, and I've been looking on the internet. Of course you have. Been looking on the internet and I've decided I have pancreatitis. And I said, well, if you do have pancreatitis, you need to go see a doctor right now. You do have Medicare A and B, and you don't want to delay this for a couple of weeks. You don't know what's going to happen, and maybe you've got something else. You don't know. Just because Dr. Google has diagnosed it for you doesn't mean that Dr. Google is right. So, the long story short is she had put off making a decision for whatever reason. She continued to pay $600 a month for Obamacare for something that was really not going to do her any good, since she had already signed up for Medicare. And she's going to end up with maybe a bigger hole in her pocket than what she was planning on. Hopefully not. But that's what happens sometimes when you decide to do it yourself. And I'm not being critical. There's a lot of people out there that want to do it this way. But sometimes it doesn't hurt to talk to somebody like me that has been in the health insurance business for over 40 years, and I'm also on Medicare. I may not have all the answers, but I've got a lot of them, and at least point you in the right direction. So, this is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.